Morning, Simon. I'm very glad that we've got an opportunity. I believe you've got a case that you'd like to discuss.
Yes, good morning. Thank you so much. I really appreciate it. I'm really just needing some help with the patient. I'm hoping we could also make it an entrustment-based discussion.
Yeah, sure, no problem. Let's follow the SNAPPS structure in terms of presenting the patient. So let's just start off with a summary of your patient.
Okay, great. So I've got a 62-year-old woman. She's been diagnosed with type 2 diabetes for about 15 years. She's been on insulin for over a year. I've been seeing her at my clinic, and we're just struggling to get her HbA1c specifically on target. It's currently sitting at 9.2%, but she's already on 46 units of Actifane at night and 46 units of Actifane in the morning and 38 units at night.
Okay, so let's just narrow that down in terms of what have you considered up to now and what have you done about this high HbA1c?
Sure. So at first I was focusing on her blood sugar diary. I was hoping that would give us a bit more insight. She's actually very diligent in checking her sugar in the morning and at the night before she injects, and we adjusted her insulin dosing according to those values. So in addition, I was also focusing on her injection technique and sites. I was wondering if maybe there was something happening on that aspect. She wasn't absorbing the insulin correctly. And we also discussed how she was storing her insulin. I thought maybe there's a problem with how the solution was becoming unstable and not working so well. We spoke about the injection sites being switched around from her stomach to her arms. Her daughter's also very involved, and she's assisting. And I also discussed some lifestyle changes, such as limiting any sugars.
So it sounds like you've been adjusting, and what's the blood sugar diary looking at the moment?
The blood sugar diary is actually not looking too bad.
So the blood sugars are nice and on target, but your HbA1c is still quite high. So that's interesting, right? So what do you think is going on? What is your assessment? What do you want to do about this? Yeah.
So I was wondering, maybe is Actifane really the best choice for her at the moment? Because it's a combination of short acting and a long acting. I'm not really wanting to increase the dose of her insulin because I'm worried she's going to start getting hypoglycemic, because on the diary it actually looks all right. I was wondering about whether we could change to a basal plus regimen and give her a long acting and short acting as separate injections. But I'm not sure if she'll manage a more complicated regimen. So yeah, I'm just a bit concerned about that. But I'm also going to ask her to go to a dietitian, even though she's already doing quite a good effort at eating healthily.
Okay. This is a great case, and actually it's a scenario we see quite often, this challenge of the high HbA1c, and then for some reason the blood sugar diary is looking so great. So what I really like and what I think went really well with this case is that I'm happy that you looked at all these other factors. So you were looking at the injection site rotations, and I can hear you're really confident in how do we adjust that insulin dosing in terms of actually getting her blood sugar diary much better. But I also think it's important we do look at the context of her. And of course, there's a little bit of a worry now when we're splitting this insulin. That means that at every single meal, she's going to have to check her sugars and adjust her insulin according to what she's eating and her sugars. And that becomes much more difficult and more complicated for the patient. I mean, have you had some thoughts about why there's this discrepancy between the blood sugars being so high, the blood sugars being completely normal and the HbA1c being so high?
Yeah, so I have been thinking about that. I was thinking that it might be due to the fact that she's measuring her blood sugar before she eats. Maybe the blood sugars are high in between the times that we've got those readings for.
Well done, yes.
So I've actually asked her to do some blood sugar test 2 hours after eating, and maybe we can see what the postprandial levels are doing.
Well, that's an excellent idea. So what you've done there is you've been able to identify, okay, hold on, what else is causing this problem? And I agree with you, it probably has to do that the amount of carbs she's eating is not matching the amount of insulin that we're giving.
Okay, sure.
So one of my top tips in something that you can do is actually becoming much more focused in terms of the diet.
Yes.
So before we start splitting the insulin, which is going to make things a lot more complicated, can we start making sure that the amount of carbohydrate she's eating is actually matching the amount of insulin that she's giving?
Okay.
So one of the things that I like to teach my patients is, for example, if they're on Actifane, remember it's twice a day. So just get them to not eat any carbs for lunch. You have to explain to them what a starch is and look at the kinds of diets they can afford, for example, having eggs or pilchards and vegetables for the lunchtime meal, because that meal is not well covered.
Sure.
And then you want to start designing with them, what are they having for breakfast, what are they having for supper. We want to make sure it's obviously unrefined carbs. There's a nice sort of guide from the dietitians, no more than the size of your fist. So either one slice of bread or a few tablespoons of oats, and that you actually want to keep it the same every day, because your insulin is the same every day. So they can't have a wide variety of carbohydrates that they're doing. And maybe doing that first might actually get your control better before we start considering going onto the bolus plus.
Okay, great. No, that sounds really helpful. I really appreciate that. I'm going to advise her to do some postprandial glucose testing. And you can also have a good discussion about how to kind of get a more specific diet around her carb intake.
Excellent. Thank you very much. Yes, and then I think go into a little bit of further reading. And then I would like you to think a little bit specifically about having the kinds of foods our patients eat and how do we help a diabetic who's on a shoestring budget actually eat in such a way that it's a real challenge in terms of the cost of food as well. So why don't you go and look a little bit at that, and it might even be nice to look if we can design a little patient leaflet on specific dietary advice and things they can do at home. So thank you very much. I look forward to our next case discussion.
Thanks, very much appreciated.
Okay.
Awesome.
Thank you.